How common is chronic pain after cancer? Now, as people survive longer and longer after cancer, and treatments for cancer are getting better, we are now recognizing a much bigger problem, and that is of what's called cancer survivorship. What does it mean to live after cancer treatment? What does it mean to live cancer-free, but now left with the side effects of treatment? And one of the commonest side effects after cancer treatment is pain. Now, chronic pain following cancer treatment or cancer itself can be broadly divided into three categories. One is the pain due to the condition itself, due to the tumor itself. The second is the pain that comes due to any kind of treatment-related impact, which is mainly due to the chemotherapy or the radiotherapy, so the drugs that are used. And the third is the surgical element of pain that comes because of any particular surgeries that have been done as part of palliative or what's called debulking, just reducing the tumor, or actually trying to completely take the tumor out and having a collateral damage either to a part of the body or to the nerves that get cut. Each of them behave differently, and unfortunately, many of them do not have a satisfactory cure at this point of time. First of all, chronic pain is extremely prevalent. The studies indicate that it can range anywhere between 30 to sometimes going as high as 70 to 80%, depending on what exactly is the underlying cause. One of the big challenges of advancing cancer treatments is that you're using drugs now that have not been fully studied. They have been introduced for rare cancers, or they've been introduced quickly because we want to get compassionate use for certain conditions. But the challenge is we don't know what the after effects of the drug are going to be because we've not done the full trials and studies after it's been released or given to large numbers of the population. And we find that some of the newer drugs, and I can go into some of them a little later or in another video, they have got the ability to affect the energy factory production in cells. And unfortunately, they are not specific only for the cancer cells. They affect any actively dividing cell, which means it can be nerve cells, it often is the hair cells, it can be the skin cells and the cells or that line the tummy. Which is why you see that most of the side effects of any cancer treatment can be around hair loss, can be around skin changes, and the impact on the nervous system, which often ends up as a variety of small nerve damage called neuropathy. But increasingly we are recognizing that the nerve damage that occurs due to the newer chemotherapy or immune therapy drugs are not responsive to the usual nerve medications because they go about damaging the energy factories, the mitochondria, so they behave very differently. Coming back now to the first point here. Now the tumor itself in shape or size, as it enlarges, can press upon a nerve or push a nerve aside or press upon certain muscles or bones, and that can be one common reason for pain. The second is the surgery-related nerve cutting. That can be another common reason for nerve pain. And the third is the impact of the immunotherapy or the drug therapy, which can damage not the nerves, but also the muscles or other structures or the nervous system as a whole or the immune system, and that can cause pain. What we're realizing is that when you have these kinds of pain, what could be the various categories that would result in treatments? So the first is when nerves are obviously injured or cut. That kind of pain is called neuropathic pain. The neuropathic pain does have certain nerve medications, so drugs which are used as antidepressants like duloxetine or amitriptyline, drugs which are used for other forms of epilepsy like gabapentin or carbamazepine or pregabalin. They could be used as nerve pain medication. There's certainly a role to look at certain kind of nerve blocks to see injections or interventions can help. And there is possibility and research being looked at newer drugs like ketamine, or sometimes even newer preparations to specifically focus on nerve, either through a spinal cord stimulator or through an intrathecal, like delivering drugs to the spinal cord. So those are the interventional ways of trying to manage neuropathic pain. If you do have active inflammation where there is a change due to the immune cells or due to the cancer treatment, that kind of acute pain could respond to anti-inflammatories or even opioids. So that's the nociceptive pain. But when you have damage to the energy factories of the cells, when you have the immune therapy affecting the immune system and the nervous system together, what ends up happening is you have a sensitization of the nervous system. It's an entirely different kind of pain, and it's called nociplastic pain, because it may not be that this pain is due to just the nerve damage or inflammation, but it's because the nervous system and the immune system have become sensitized due to the treatment. And this kind of treatment problems do not respond well to either the traditional drugs we have or even the surgeries. We're now realizing that we need more integrative options. We need options that look at calming the immune system down and calming the nervous system down. That means looking at micronutrients, looking at dietary changes. That means looking at integrative mind-body techniques like acupuncture, or for that matter, even simple, gentle, calming techniques like yoga or Pilates. And these are what forms the integrative approaches. So I hope you found this useful. You realize that chronic pain after cancer is quite common, but it needs a much more multidisciplinary, more integrative approach. And that's what we should be looking at for chronic pain after cancer. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.